Hello friends and welcome back to Panache Aesthetics. I am Dr. Ankit Gupta, Senior Plastic Surgeon at Panache Aesthetics Pitampura, and today's video would be on liposuction. Liposuction especially of the love handles, of the flank areas and of the back. So today we are addressing liposuction of the back. So I'll be explaining you everything about back liposuction in a female, how we do it, why we do it, using 3 to 4 different patients, different patient profiles, so that you can relate to what you have and how you can get rid of all the fat that is on the back or in the sides. So what is different in a female from a male? So in a male patient, they want to go for a V shape, whereas in a female patient, everybody wants an hourglass shape in which you have a narrower waist and the buttock area or the hip area is the widest. So I'll be explaining you, or I'll be taking you through how we do back liposuction at our center in Pitampura in Panache Aesthetics through these few cases. So starting off with this lady, in this lady you can see the markings that I have done. Don't get confused with so many lines, but yes, if you see, there's a lot of fat in her upper back, the middle portion as well as the lower portion. And if you see clearly, the waist is very broad and the hip area is narrower compared to the waist. The thighs are broad. Starting from the top, if you see, I have marked in black the areas which have excessive amount of fat. We have marked her back portion, the upper back, in which there is a lot of extra fat, and all that fat is removed through a very small cut given in the posterior axillary fold through these small cuts on both the sides. Then I have marked the waist area, the excess amount of fat in the waist, and then the lower portion of the torso, in which I have marked all the extra amount of fat. So these are the gross areas which we would want to remove the fat from. Now the most important part, how a female liposuction differs from male, is through these red lines that I have marked in her. So if you see clearly, this red line which is going up from the gluteal cleft to the waist, the narrowest portion of the waist, and there's a second line just below it. The V that is found between this is sucked out thoroughly so that the waist becomes very narrow. The V which is below this is also sucked out, but to a lesser extent, so that there's a gradual progression that happens from the waist towards the hip, and we do not suck out fat from the hip area. But in her, we have not put down any fat in her hip area. In fact, we have taken out fat from her thighs. In the black, we have marked the areas from where we are going to take out the fat. Over here also we take care to give it a gradual shift so that there is no depression following the surgery. It is very smooth. So this is how we plan the liposuction of the back, and as you can see in her pictures, this is the immediate result on table. And even here you can see the very good hourglass shape that we have been able to achieve with only taking out fat. We have not grafted any amount of fat in her buttock area. We have only taken out fat from her waist. We have taken out fat from her thighs, and this is how she looks in her post-operative pictures. So moving on to the second case, this is a patient. She traveled from Africa to us, and she wanted a better looking back, in which she wanted to get rid of all the extra amount of fat that she had on her flanks, on the love handles and the back. Although she wanted much bigger hip area as well, but she was not willing to get fat grafting done to her buttocks, and we planned her liposuction in a way so that we were able to remove all the fat from her flanks and from the love handles and the back area. And you can see the significant difference that you can see on table itself. And even on table you can see that the hip area is now looking wider compared to the waist area, whereas initially in before pictures you could easily appreciate that the waist area was much broader than the hip area. Moving on to another case in which this lady, an Indian patient, she had a lot of folds in her back, and she wanted to get rid of these folds, the multiple folds right across her body from the top to the bottom. This is how we have marked her, and you can see we have marked her arms as well as the whole back. The deep liposuction we will be doing from all across her back, and we were doing a lot of other things for her, and so only a deep liposuction from the back. And this is how she looks afterwards, and you can see in the before after pictures how most of the folds have been eliminated, all the extra amount of fat has been reduced, and she's in a much better shape than what she was before. Now this is another case in which we did her liposuction. We did a 360-degree lipo for her tummy, the waist, the back as well. And since this video is only on back and flanks, so I'll be showing you how the results are from the back. And she otherwise had a good physique, but she wanted enhancement, a high definition lipo, and this is how she looks. We have removed out all the fat from her back, and you can see in the before and after how well the waist is, how much the waist has reduced, and we have not grafted any fat to her buttock area, and you can appreciate that the waist is much narrower compared to the hip region. Coming to the last case, in which in this patient we have taken out fat from her waist area, and we have done a fat grafting to her buttock area. Otherwise very fit girl, she too came from Africa, and we have taken out fat in the similar way from her flanks, from her back, and injected that fat into her buttock area, and this is her result. And you can see how good hourglass shape she has been able to achieve with the combination of liposuction along with fat grafting. So this is how fat grafting can be combined with liposuction, and in this video our main purpose was to show that flanks or the rigid area which do not get removed easily through your exercise, which you are not able to get rid of with exercise, which diet and all, can be easily tackled with a very small procedure known as liposuction. And if you need to know anything in detail about liposuction, if you wish to know more about how one should go about liposuction, you can always visit our website panashaesthetics.com, or you can call us on 9599554211, and we'll be very happy to help you. Thank you.